The health department is now studying the possibility of a shorter quarantine period for vaccinated individuals. To tell us more, we have JC Cosico joining us live from Mandaluyong. JC, hi. What prompted the DOH to consider the shorter quarantine period for vaccinated individuals, and how short exactly are they planning to cut quarantine to?
Sean, according to the health department, the shortened quarantine period for the general population will also be the same of that of health workers. So that means 5 days for the positive, mild, and asymptomatic COVID-19 positive patients. Now, that's if they are fully vaccinated and no quarantine or isolation for those close contacts. So that's amid rising COVID-19 cases, Sean.
That's right. Amid this same rise in COVID-19 cases, very steep rise that we've seen in the past 2 weeks, some are saying, JC, that the shorter quarantine policy is actually illogical. What did the DOH have to say counter to that?
Sean, according to the health department, they won't put the public, the patients, and the health workers at risk, saying that their decisions are based on science and on existing evidence. Now, according to Health Undersecretary Maria Rosario Vergere, there are also countries doing the same. And apart from that, they are also planning again to include the general population on this, Sean.
Right. And JC, I'm going to have to ask you the DOH's outlook on the number of cases. What should we expect in the coming days? We know today came in a little low, but it's also Tuesday. Historically, we get lower number of cases on Tuesdays. So what are the latest projections? And can we really expect it to peak at 40,000 cases per day?
Sean, there was no mention on this during this afternoon's press briefing, but according to the DOH, they are expecting COVID-19 infections continue to increase in the coming days because of the high transmissibility of the Omicron variant. Sean.
Right. And of course, all the NCR mayors are saying it's not yet time to go on level or COVID alert level 4 because our hospital occupancy rates are not there yet. What is the latest numbers on our hospital utilization rate?
Sean, according to USEC Vergere, the country's national healthcare utilization rate remains to be at low risk, 40% for ward beds, while 38% for ICU beds. But there are some regions like here in NCR nearing the moderate threshold when it comes to COVID-19 beds. But this is not much of a concern yet, according to the health department, if we are going to compare this during the surge of the Delta variant. Sean.
All right, and speaking of variants, JC, Omicron is now considered dominant here in the Philippines, but can the DOH actually categorically say that there is already widespread local transmission, or have they actually come out and said it?
Sean, the DOH said that there is no establishment yet of the local transmission of the Omicron variant in the country, but there is high likelihood that the variant is now in the communities, according to Undersecretary Vergere. Now, she also clarified Health Chief Duque's earlier statement that Omicron is now the country's dominant variant, saying that the health chief was just referring on the latest samples sequenced. That's according to USEC Vergere. Still, the dominant variant in the country, according to the DOH, remains to be the Delta, followed by the Alpha variant and the Beta variant. Sean.
All right, we'll leave that there for now. Now, regarding COVID-19 test kits, which are selling out everywhere in the gray market, JC, the FDA, of course, recently opened applications for self-administered COVID-19 at-home test kits. Are there any applications already up for review for now?
Sean, the DOH confirmed that there are two manufacturers or suppliers of self-administered test kits which applied for a product registration with the country's Food and Drug Administration. Now, they are now expediting this so that the public can administer COVID antigen tests at home. But once these are out in the market, the DOH said that the public must be careful on using this to avoid misuse or miscalculation. Or misinterpretation, rather, Sean.
All right, JC, thank you so much for giving us all those updates and numbers. That was JC Kosikov, News 5, reporting to us live from Mandaluyong City. Stay safe, JC.